Our practice is unique on several fronts. First of all, the way in which we see our psychiatric patients, the model of that you would see at a internal medicine office or a primary care office somewhere. We feel that that model works much better than the old-fashioned model because of the fact that you actually spend more time with patients, and they're very used to that. They're used to that idea of somebody coming in to see them. It's also really unique because of the fact that we take care of all this whole spectrum of problems. Most psychiatrists understand that the patients with severe mental illness die on the average of age 55, so about 35, 40 years sooner than any other patients. And that's because of the fact that they don't receive primary care very well. I'm going to tell you a story. A while back, I had a patient who was schizophrenic that I got a call on from the family that they had taken her to the emergency room. The emergency room told them that she was really psychotic, they needed to see me. So we brought her in, I took a look at her. It turned out that she had a strangulated bowel. That's why she was acting the way she was acting. She came very close to dying. What ends up happening, and I'm sure that a lot of you have had this experience, your patients go to the emergency room and they're blown off, they're not given proper care because they're hard to work with, they're difficult. They're on all these medicines that a lot of docs don't understand very well. That's why we started this practice in the way we did it. It's become very successful. 5 years ago, I started with myself and 3 people. We're now myself, 3 psychologists, 3 nurse practitioners, and a staff of about 30. So it's grown exponentially in 5 years. 2 weeks ago, we had 85 people calling for to come in as new patients. We have gotten publicity, I hate that word publicity, but we have gotten notice from other places in the United States because of this model and the way it works. Shepherd Pratt has talked to us, USA Today has talked to us, there's even talk of a documentary on Showtime. I think that shows that in fact it's unique and that it really works for this community. This community is different. This community that we deal with, they're all Medicaid, Medicare, indigent. They're people with not very much. I give away services. Don't let the administrator hear me, but I give away services a lot. But we're always trying to make sure that people get what they need. We have nurses that bring in food for people. We bring in clothes for people. I am 70 years old. I'm going to be retiring soon. I can't tell you exactly when, but soon. I'm old, I'm tired, I need some help. I'm looking for somebody that understands this model, is willing to learn how to do this, who's willing to come in and take over for me so that this can continue on. It's become the bulwark for healthcare in this community. If we folded up, there would be an awful lot of people with an awful lot of pain that wouldn't know what to do.